James Vanderbeek's last act was as an advocate.
If I can help anybody avoid the expense and the time and the pain and the everything I've had to deal with and the fear and telling friends and relatives and family and all that, if I can help someone avoid that, that makes me feel good.
Back in December, the actor best known for playing the title character on Dawson's Creek talked to Newswatch 16 about his battle with colon cancer. He passed away in February, his wife Kimberly telling the world that his treatment nearly bankrupted them. A GoFundMe page for the Vanderbeek family has since raised $2.7 million. Even a Hollywood actor can fall into a troubling statistic. According to the American Cancer Society, more than half of cancer patients in the U.S. take on medical debt, and cancer patients are 70% more likely to face tax liens and foreclosure.
You can imagine how that fear of medical debt or the reality of existing medical debt can really throw off cancer care. It results in people delaying the needed scans, the needed follow-up and treatment, and sometimes people forego that care altogether.
Donna Greco from the American Cancer Society is lobbying for a series of bills making their way through the legislature in Harrisburg that addresses the cost of cancer treatment. One of those bills, House Bill 79, would have the government buy back Pennsylvania's medical debt that has been sent to collections. Representative Bridget Kozarowski from Lackawanna County is a co-sponsor of the bill that passed the House last year but has stalled in the Senate.
And sometimes it takes people that are actually in the throes of having cancer treatment that we actually have to ask them, hey, can you call your senator to make sure that they understand how important this is? It's unfortunate, but I will say advocates that come to Harrisburg, advocates that speak to their family members, advocates that come and talk to us, this is how sometimes legislation does get passed.
Kozarowski knows firsthand how expensive cancer treatment can be. 20 years ago, her son Jacob battled and beat leukemia. And even though she and her husband both worked full-time, they struggled to afford it.
Jacob's treatment was 5 years. And 5 years of really expensive medicines that he had to have. And we were treated at Children's Hospital in Philadelphia, which is out of network from what I was covered here in my insurance plan here.
Affordability is often what brings local cancer patients to the Northeast Regional Cancer Institute.
Oftentimes it's a financial need.
Karen Rechak says the NRCI takes a more micro approach, helping connect patients with programs and charities that can help cover costs that come up during treatment.
Sometimes it gets more complex. You know, I'm the primary breadwinner. I now have cancer. I'm now getting treatment. I'm not able to work. How is that, affecting me, and what can you do to help? So there's a variety of reasons people call us. Along with that, there's a variety of resources also available.
And NRCI adds that early detection of cancer can dramatically drive down costs of treatment, and especially in cases of colon cancer, can dramatically increase your chance of survival. Stacy Lange, Newswatch 16, Lackawanna County.